Tim Bennett here from the Cortland Voice, and I'm here with Tammy Walrath of Cayuga Health. Tammy, how are you today?
I'm well. How are you doing?
I'm feeling blessed. I'm feeling really good. So Tammy, tell us. I know that we're going to be speaking today about sleep apnea, but before that, let's hear about you. Maybe where you're from or your education. Tell us something interesting about you. Maybe you have dogs and cats, and anything. What would you like us to know
Um,
about you?
Great. I've lived in upstate New York most of my life. I was a nurse for a couple of decades before I went back to school. Studied at SUNY Cortland for community health, and I went to Upstate Medical University for my master's degree as a physician assistant. And I live locally near Homer, New York.
Awesome. So that makes me excited because I know people are watching this. I'm literally finding this out in real time. I'm a Cortland alum as well. So go Red Dragons. Uh,
Yeah.
so let me ask you this. Tell us about sleep apnea. What is it and how common is it?
It's actually the most common sleep-related breathing disorders.
Okay.
It's most common in older men, but it can also affect females and children. And actually, after menopause, the rates are very similar for postmenopausal females.
Okay. So what causes it? And you basically have said who's at risk, but what causes it?
Well, so the prevalence of sleep apnea is actually greater in African Americans individuals and
Okay.
for people that are over 35. So older males are the highest risk. Obesity certainly plays a role as well because, we gain weight everywhere, even our tongue. But there's also, some craniofacial abnormalities. And actually Asian populations have higher risk of that genetic changes that can contribute to that. So regardless of age, weight, and gender, your race can also play a role.
Oh, wow. So, me personally, I feel like I sleep well, people always
Mhm.
ask, hey, did you sleep good? I feel like I get good sleep, but how would you determine what good sleep is and how does sleep apnea disrupt that? Maybe I'm not getting as good of sleep as I'm thinking. You get a good meal, knockout.
Mhm.
Yes.
Mhm.
Talk to me.
It's an interesting frame of reference because it's really what are you used to? But so some people have family history of sleep apnea and they can say, yeah, my dad, his snoring would shake the paint off the wall. I love that phrase. It's funny. But if your sleep is restful and you go to sleep at night, you have no problem falling asleep, you sleep through the night and you awaken and you feel refreshed, ready to meet the day. You don't need a nap during the day. You're not tired. That is good sleep. Some people feel like, oh, it's normal to wake up 1, 2, 3 times a night. They often have to get up to go to the bathroom several times a night. That's actually a hormone imbalance that could be contributed to by sleep apnea to make you have to go to the bathroom more often.
Hmm.
And then awakening in the morning feeling like you haven't even slept. That can be a very common symptom of sleep apnea, or even having trouble falling asleep or staying asleep. That could be sleep apnea.
So if it's uncontrolled, what are the dangers of sleep apnea?
This is the hard part because finding this before you have the symptoms,
Mhm.
and that's why it's important to follow up with your primary care annually because they can see those signs and symptoms to begin with. But untreated sleep apnea increases your risk for atrial fibrillation, which is a heart arrhythmia. It
Mhm.
can contribute to having a stroke or heart attack, high blood pressure, diabetes, depression, sudden death. People can die in their sleep and just not wake up because of sleep apnea. And it also contributes to increased rates of accidents or injury because either falling asleep at the wheel or you're just at higher risk of hurting yourself.
Oh, wow. Um, so let me ask you this. When should someone speak with a healthcare provider about something like this? Is there a certain age maybe that they should check at, or maybe if maybe you were able to get a good amount of sleep over a certain amount of time, and let's say something tragic happens and that's messing with things can an event, maybe a car crash or something like that, or a loss of a family member, can that cause someone to get sleep apnea, something like that? Or
So, a car accident that was caused by being fatigued can be a sign of sleep apnea. But having a tragic event, an injury, or something traumatic happening that's caused you to have abnormal sleep, difficulty falling asleep, staying asleep, that's something altogether different. We do manage insomnia with cognitive behavioral therapy here, but the symptoms that you would want to see a primary care about is really that unrefreshed sleep, or your partner saying you snore a lot, or you are not breathing when you're sleeping. Those, or waking up with a racing heart, or waking up gasping, feeling short of breath.
So do you have to, if one felt that they should be checked, do they have to spend the night like at a clinic or something like that?
So there's different testing modalities. One is a home sleep study, and it's actually something that we assess you for. And if we think you're a good candidate for that and your insurance approves that, you can actually do the test at home. And you just keep it for overnight, sometimes 2 nights, and you return it and we review the data. Another way is an in-lab sleep study, where you actually do spend the night, and that has more bells and whistles. That can do more sensitive testing that will be more likely to diagnose. That's really the gold standard. The home sleep study is less sensitive, but there are 2 different types of testing. And within that, there's actually some variability, but that's your standard.
Okay. Now, what are the options to treat it? So like once it's been determined that that's the case, someone gets that diagnosis, how can we, how can we treat this?
So there's several different options actually, and depending on severity. So if you just have mild positional sleep apnea, CPAP is always the gold standard, which is continuous positive airway pressure. And it's a device that delivers air, not oxygen. It's not a ventilator, but it delivers pressurized air through different types of masks. And that actually stents the airway open. So it allows your airway to move air while you're sleeping, because as we sleep, things get weaker and we lose tone. But that's one option. If it's just mild and it's positional, so you only have sleep apnea, say laying on your back, we have different props that we can recommend to help you stay on your side. Weight loss can help to reduce that. There's also a mandibular advancement device, a little device that's like a hinged retainer on steroids that pulls the lower jaw forward. And of course, since 2016, there's the hypoglossal nerve stimulator, which is a surgical implant. And that's kind of down the road with treatment.
Gotcha. So let me ask you this. What is a CPAP machine? And for those watching, CPAP, because I did some research, and what is that? And are there other options other than that? I want people to know about that. Tell them what that is.
So I'll try not to get into the weeds with this, but the CPAP itself, there are different modes of this, CPAP, BiPAP, ASV. But the device takes atmospheric air and it actually compresses it. If you're familiar with a compressor, and it uses centimeters of water pressure. And we have different types of modes that we can put that in. And it just applies that pressure to keep things popped open for you.
Well, it's great that you have so many different options and ways, to make any, future client, comfortable, any patient comfortable. So if there's a closing word that you'd want to leave everyone with, Tammy, what would you say to them?
Don't believe the negative stuff about treatment of sleep apnea, because people come in a lot and they're like, I don't want a CPAP. I hear all of this, like you have to wear this mask. It's awful. It's a torture device. And there are a lot of ads kind of promoting different things that are not FDA approved. We are so good at helping you get comfortable with a CPAP. And there's so many different options with a mask. And I closely follow patients in making sure that the pressures are comfortable and that they're well treated. And we also support the weight loss program here at Cayuga. And it's a whole team, and I'm literally your biggest cheerleader. So it's really, we want to prevent those, really serious outcomes. It's pretty tragic to lose somebody because of untreated sleep disorder.
Okay. Well, many times people call me the biggest cheerleader at 6'6". I'm just kidding.
Must be a SUNY Portland thing.
Yeah, we're the Red Dragon, for sure. The Red Dragon pride. I love it. But Tammy, thank you so much for joining us today and educating us on sleep apnea. And to everyone watching, Thank you for tuning in. God bless.
It was my pleasure. Thank you.